Your dog started making hacking, honking and whooping sounds and you are not sure what this means and what to do? Watch this video as I'll be going over the top 8 most common causes of coughing in dogs, as well as the diagnoses and treatment options. Hey guys, Dr. Peach. Now, the occasional cough in an otherwise healthy dog is usually nothing to worry about, but when it does become a constant or recurring problem, it can be a sign of some serious underlying illness going on. So, here are the top 8 most common causes of coughing in dogs. Number 1. Coughing due to infections. Now, a dog's respiratory tract can become infected with all sorts of fungi, bacteria, viruses and parasites, which can cause pneumonia in lung tissue, bronchitis in airways, or a combination thereof, called bronchopneumonia. Kennel cough and canine influenza virus are the 2 most common infectious causes of coughing and will require supportive care, antibiotics and sometimes even cough suppressants to be treated effectively. Number 2. Coughing due to heartworm disease. Heartworms are transmitted to dogs through the bite of a mosquito that pick up the larval form of the parasite from one infected dog and carry it over to the next. These little larvae migrate to the heart and lungs where they mature into adults, causing loads of inflammation as they move along, which can lead to fatal heart and lung damage. Heartworm treatment can become very costly and does not always guarantee a full recovery, so the best will be to use preventative medication that are both extremely safe and effective. Number 3. Coughing due to heart disease. Several different types of heart diseases can make dogs cough, with mitral valve endocardiosis, dilated cardiomyopathy, and congestive heart failure being the most common. Depending on the type of heart disease your dog has, your vet may prescribe a combination of medications to help the heart pump more effectively, such as pimobendan, to help normalize the blood pressure, such as enalapril, and to reduce the abnormal amount of fluid buildup in the lungs, such as furosemide. And in more severe cases, your vet may even consider surgery or the placement of a pacemaker. Number 4. Coughing due to collapsing trachea. Small and toy breeds such as Yorkies, Pomeranians, Poodles and Chihuahuas have an increased risk of developing a weakening of the cartilage rings that partially encircle the trachea. This can cause the trachea to collapse on itself, that leads to tracheal irritation and a chronic cough that almost sounds like a goose honk. This condition can be managed up to a certain extent with medication that will dilate the airways, reduce inflammation, suppress the cough and treat secondary bacterial infections. But in severe cases, surgery where a stent is placed to restore the tracheal wall's integrity may be necessary in order to provide these dogs with an acceptable quality of life. Number 5. Coughing due to laryngeal paralysis. Dogs suffering from laryngeal paralysis are not able to fully open the larynx, which is basically like the passageway into the windpipe. This is due to a weakening of the nerves controlling the muscles surrounding it and can often lead to chronic coughing as well as noisy breathing and shortness of breath. Surgery to permanently hold the larynx open will help to ease the breathing in these dogs, but this in turn will also put them at a higher risk of developing aspiration pneumonia, as they won't have full control as to when to open and when to close the larynx, and can therefore accidentally allow foreign material to enter the lungs that can have disastrous consequences. Number 6. Coughing due to chronic bronchitis or asthma. Dogs with chronic bronchitis tend to have a dry, hacking cough that is more prominent during excitement or exercise and gradually worsens over time. Treatment usually includes medication that will reduce the inflammation, such as fluticasone or prednisolone, and dilate the airways, such as albuterol or terbutaline. These medications are given by inhalation and are very similar to what humans that have asthma use. Number 7. Coughing due to cancer. Coughing is one of the first signs that owners will notice when a dog has cancer of the lungs, other parts of the respiratory tract, the heart or surrounding tissues. And treatment may include surgery, chemotherapy, radiation or palliative therapy, and the prognosis will depend on how long the tumor has been going on as well as how far it has spread before treatment was started. And number 8. Coughing due to foreign objects. Dogs may sometimes accidentally inhale foreign objects that get lodged into the lungs. The body's natural response is then to either cough or sneeze it out. And if this is unsuccessful, then the foreign object can be removed either via an endoscope or via surgery. If your dog only recently developed a mild cough but still seems to be fine otherwise, then it is reasonable to wait a couple of days to see if it clears up. However, if the cough is very severe, worsens, or does not improve after a couple of days, then you should make an appointment with your veterinarian. Also, if your dog is by any chance lethargic, has difficulty breathing, isn't interested in food, or has any other potentially serious problem, then you will need to call your vet immediately. Now, as much as you would like to, there is unfortunately no way that you can accurately diagnose the exact cause of a dog's cough by only listening to it. Sure, a dry, non-productive cough may indicate that the upper respiratory tract is affected, and a wet, productive cough may indicate that the lower respiratory tract is diseased. But there's often an overlap, and it is therefore very dangerous to presume your dog has a specific disease based on only the sound of its cough. As you can see, coughing is associated with a number of diseases, and a careful diagnostic plan is therefore essential for establishing an accurate diagnosis. Your vet will need to take many things into account, including a thorough history, complete physical exam, in some cases blood work, x-rays, ultrasonic imaging, and fecal tests. And in more advanced cases, bronchoalveolar lavage, bronchoscopy, transtracheal washes, thoracocentesis, and an echocardiogram in order to rule out the most common causes and to end up with the most accurate diagnosis and concurrent treatment plan. It is important to remember that coughing is the body's own natural defense mechanism, used to keep the respiratory tract free of harmful substances, foreign material, and excessive secretions, and therefore should not always be controlled without first consulting professional advice, as this may only hide the problem and allow it to worsen. Some mild coughs can be treated at home with medicine containing an expectorant, but many over-the-counter syrups that suppress coughs should not be used in dogs, so always consult your veterinarian first. Thank you for watching this video. If you would like me to cover any of these topics in more detail, please let me know down in the comments. And if you found the content to be helpful, make sure to smash that like button, share it with your friends and your family, and if you are new to my channel, consider subscribing, as I'll be posting new videos on interesting pet-related topics every week. As always, have a lucky day, and I'll see you in another video next week. Cheers!